How is separate CHIP different from Medicaid? Imagine trying to find the right health coverage for your child and feeling overwhelmed by all the options. Two programs often come up, Medicaid and CHIP. They both help families with low income, but they work differently. Let's explore how separate CHIP differs from Medicaid so you can understand what might be best for your family. Medicaid is a big government program that provides health insurance to a wide range of low-income people. It covers children, pregnant women, adults, seniors, and people with disabilities. It is an entitlement program, which means if you qualify, you are guaranteed coverage. The federal government provides funding that matches what states spend, and there is no limit on how many people can enroll. If you meet the criteria, you have a right to Medicaid. CHIP, which stands for Children's Health Insurance Program, was created in 1997 to help children and families that earn too much to qualify for Medicaid but still can't afford private insurance. Some states run CHIP as an expansion of Medicaid, called Medicaid Expansion CHIP, while others operate it as a separate program with its own rules, known as separate CHIP. A few states use both methods. One key difference is how funding and enrollment work. Medicaid is an entitlement program, so anyone who qualifies can enroll without restrictions. Federal funds are unlimited for eligible individuals. Separate CHIP programs do not guarantee coverage for everyone. They may have caps on enrollment because funding is limited. If funds run out, states can pause new enrollments or put families on waiting lists. Eligibility also varies. Medicaid covers the lowest income families and individuals, including children, adults, and seniors. CHIP generally covers children and families with slightly higher incomes, sometimes up to 200% of the federal poverty level or more, depending on the state. Both programs use income calculations, often based on modified adjusted gross income, but the specific rules can differ slightly. States have more flexibility with separate CHIP programs. They can design benefit packages that look more like private insurance, including charging premiums and copays. Medicaid benefits are more standardized and comprehensive, with strict limits on cost sharing. Recent federal rules have made separate CHIP more protective, banning practices like waiting periods or benefit lockouts that used to be allowed before June 2025. When it comes to benefits, children in Medicaid and CHIP usually get essential services like checkups, immunizations, and treatments. Medicaid offers a program called Early and Periodic Screening, Diagnostic, and Treatment, which covers many health needs at little or no cost. CHIP benefits can vary by state but are required to meet certain federal standards. Cost sharing in separate CHIP tends to be higher than Medicaid, but federal limits prevent families from paying excessive amounts. Both programs are run by states with federal oversight and funding. Because states can choose how to run CHIP, the experience can differ depending on where you live. Some families might have children enrolled in both Medicaid and CHIP, which can sometimes cause confusion due to different rules. If you are trying to decide what coverage is best, check your state-specific rules. Children who qualify for Medicaid will usually have the most comprehensive coverage with minimal out-of-pocket costs. Those who qualify for separate CHIP might have higher premiums or copays, but recent changes have improved protections against coverage gaps. Remember, income levels can change, so annual renewal is important. If your child no longer qualifies for CHIP, they might be eligible for subsidized coverage through the health insurance marketplace. In summary, Medicaid offers a guaranteed, broad safety net for the lowest income families, while separate CHIP helps children and families with slightly higher incomes access coverage with more flexibility. Recent federal rules have aligned some protections, making both programs more similar in safeguarding children's health. Always consult your state's health agencies or a qualified insurance navigator for the most accurate information tailored to your family's situation. Remember, the goal is to find the coverage that best supports your child's health and well-being.